Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the MedEdit podcast. Hello, everyone. My co-host and I would like to welcome you to a terrifying episode of the MedEdit podcast in honor of Halloween here in the United States, even though we know this will air just a few days after.
Okay, Jess, I'm probably going to date myself here, but did you ever watch Tales from the Crypt when you were younger?
No, I did not.
All right. I figured I was a little bit older than you. Well, I did without my parents knowing because I have an older brother, and as older siblings do, they get you in trouble doing things you're not supposed to. And let's just say it was terrifying and still haunts me to this day.
This is one of the reasons I don't like Halloween. It's just not my jam with all this terrifying stuff. So I don't think today's episode will be that scary. But we are going to share some surprising, scary cases we've been seeing working in the hospital. Who doesn't love a crazy medical story, right?
Yeah.
In fact, shout out to my own mother, who is a registered nurse. And I distinctly remember developing an interest in a career in medicine after listening to her tell fascinating patient stories when I was a child. Who knows, maybe these stories will actually inspire somebody else for a career in medicine, or at least just entertain. And don't you worry, we'll have educational points to accompany each of these cases for you.
I can't wait. We do want to make sure all of our listeners know that these cases have been de-identified to protect patients' privacy in compliance with all the HIPAA rules and privacy protections. And we've included some details in all of the cases as well.
Sit back, relax, put those headphones in so you don't scare your neighbor. We are here to edit out the noise and bring you medical education without misinformation.
All right. Well, I'm going to go first today. So as I was once told, buckle up, Buttercup, because this is an interesting one. So many, many moons ago, when I was a youngish doctor, my team and I were called to evaluate a patient who brought in by the police after being arrested because they had swallowed some bleach while fleeing from the police. And of course, as they do, they bring them in for medical evaluation before they take them to jail to make sure that it's safe to take them, right? Appropriate.
Pretty standard.
Yeah. Now, for any listeners who don't know, this is a pretty typical consult for a gastroenterologist. There's over 44,000 inquiries to poison control every year about bleach ingestion. So we can be busy at times. It's actually the leading cause of accidental poisoning in the home. And then when you get certain trends on TikTok where people are telling you to swallow bleach, it's even higher.
Ooh.
Yeah. Many times we usually perform what we call an endoscopy or an upper camera study, usually 24 to 48 hours after ingestion. And this is to evaluate how injured the esophagus is after a caustic ingestion. It also helps determine if somebody can be discharged home. Is this life-threatening? And then also it kind of helps estimate if they're likely to have complications down the road, such as narrowing or stricturing of their esophagus. And this all occurs because, the active ingredient in bleach is sodium hypochlorite, which basically kills off the cells in the lining of your esophagus. Of course, it depends on where you get your bleach as well. The household common bleach is only about 4 to 8% sodium hypochlorite, whereas industrial bleach can be up to 50% of the active ingredients. Obviously, a lot more caustic to ingest than what you would find at home.
Oh, gosh. Well, why would somebody even ingest bleach? I mean, I, again, have heard this too and seen this in the ER. But again, why is somebody ingesting bleach?
Yeah. So, well, I won't tell you in this story why they did because I don't want to spoil it. But typically these reports to poison control are children. So they're accidental ingestions, right? Their bleach hasn't been secured at home. So they're able to get into it drinking, thinking it's milk or something else. In adults, sometimes it can be due to mislabeling. Again, I don't know who keeps their milk and their bleach in close enough proximity that you can mistake them. And occasionally we also do see it as an intentional ingestion, such as in a suicide attempt.
So any pearls for an accidental ingestion at home? Let's just, take a step back and say if somebody were to have an accidental ingestion as far as like a toddler or a kiddo getting into something like that. I have kids, you have kids. They're the young ages. What would we do if that were to happen?
Sure, absolutely. So first thing I always tell people is don't try to induce vomiting. Okay. So as you can imagine, the bleach is burned going down. We don't want it to burn coming back up. So you basically will just re-traumatize the esophagus at that point. I mean, drinking plenty of water. Again, you're kind of trying to help neutralize. I've heard some people mention milk and stuff before, but I think in general, you're just trying to cleanse that off the lining of your esophagus as quickly as possible. And of course, calling poison control, which here in the United States is 1-800-222-1222.
And I will put a huge shout out to poison control. I have called them in the clinic specifically for some patients. Not to backtrack to a different story, but I've had something really interesting where a family member of mine accidentally shot themselves with, what is it called? Called like Blackfoot antibiotic something or another. It's for cattle. So you're out on the ranch and you like shoot yourself in the hand with it.
Right.
And so we're like, what do we do with this? We just injected ourselves with like 10 different kinds of medication. You can call poison control and they'll look all these things up. They'll call the hospital. They'll track you. They know where you're going, all that fun stuff. So poison control can take care of the craziest of things that, you or I, even as a physician, have never even heard of. So, well, back to our story.
Yeah. Shout out to poison control as always.
Thanks for keeping us in line.
And they're a very helpful resource. I agree, both personally and professionally. I said, back to our story. So, well, we did our usual bit. Of course, we took a history from the patient. We performed a physical and we prepared our patient to undergo an upper endoscopy to take a look. During the procedure, we started by looking at the esophagus. That's where we were concerned about. And fortunately, in this case, the esophagus looked fine. But we completed our exam, which means we took a look with our camera in the stomach and the first part of the small intestine. And right after leaving the stomach into the first part of the small intestine, we encountered something we didn't expect, which was a plastic bag.
Ooh, scary.
Yes. And of course, as you can imagine, when it's crumpled up inside of you, it can be difficult to tell what's in it, if there's anything in it, but it looked empty. So there wasn't anything obvious. And I will say it was kind of just, your generic plastic baggie that you might see. But we decided after talking to surgery and radiology who takes pictures for us and the emergency doctor that we were going to try to remove it if we could safely, just to hopefully prevent it from migrating any further down. Because as you can imagine, then it becomes a surgical problem. There's a high risk of complications if it gets stuck somewhere in the small intestine. So we used a few different tools and were able to remove it with our scope. Pretty easy, actually.
So definitely getting goosebumps. That's kind of creepy. There's just this like bag thing sitting there and you as the doctor have no clue where it is, where it's coming from.
Yeah.
It's like that TikTok video of the women finding the rug buried in her backyard and yelling, "What's in the rug?"
Yeah.
So what's in the bag, Cari? What's in the bag?
Right. Like everybody watching is like, what's in there? And I'm like, assuming since it's spooky, you're going to think I'm like a ghost or a zombie or something. But so basically we opened the bag because we, of course, wanted to make sure it was empty, and we find black tar heroin. So I'm no drug expert.
How did you know it's black tar heroin?
Well, that's, because that's street cred. Okay.
Yeah, right. Like, how are you?
It's called Google Images. All right. Actually, probably back when this happened, I don't even think Google Images existed. But anyways, but let's just say there were experts present who could tell us exactly what it was.
Okay.
And it's apparently very dark because of how it's processed. So again, it's not like you went in and saw your traditional white powder that many of us would think of when you're talking about these things. And of course, we didn't know this beforehand. Otherwise, we may have, done something a little bit differently. But he was doing something we call body stuffing.
Ooh.
Yes, which you may have seen. I mean, I feel like when I watch cop shows, I see this sometimes. So basically, hastily ingesting bag drugs while trying to evade law enforcement. And of course, our patient, for good measure, thought, I'll just watch it down with some bleach, and hopefully that bleach will dissolve everything just in case.
Like, I've heard of this and seen it on like shows, but I've never actually heard that it's called body stuffing. I feel like that's horrifying.
Yes.
And that should just count as the creepy Halloween story right there. That is so gross.
Absolutely.
But yeah, definitely not how your day was, probably how you thought it was going to go that day, right?
No, not at all. And the reason this can be really what I say a scary, spooky story for both us and the patient is that certain substances, like I mentioned previously, when we're looking for that white powder, like cocaine and heroin, they can be really dangerous to remove. So there's been cases actually, and you've seen this when people talk about body stuffing for other reasons, like drug needles, for example, that if those rupture, all of a sudden you get such a large absorption of the drug at one time that it can be lethal.
Yeah, definitely. Like, when we're talking specifically about, those like things, something like heroin. So that would be more on like the opioid category, or methamphetamine as well, which goes in a different category.
Right.
Or right now, what's one of the ones in the news is that fentanyl, right? And we're talking about the tiniest bit of fentanyl can kill. Imagine having enough to fill up a small little balloon amount in your body. And they're telling these people that there's nothing wrong. It's not going to harm them. And clearly this poor person thought adding the bleach was just going to help dissolve it, and I don't really blame them much. As just lack of education, right? They don't know that's a terrible combination of ideas.
Absolutely. And in these cases in general, again, I mentioned this was a while ago. So a lot of this information has evolved over time since then. And that's why discussion with surgery is really so important to figure out what the best approach is for these patients, whether it can be safely removed endoscopically. Again, what we saw was nothing at the time, nothing obvious. But sometimes it can be difficult to tell. And in general, if it is obvious or they tell you that that's the case beforehand, then generally you do want surgery to try to move things whole, basically.
Right. Okay. Well, that is absolutely terrifying. And especially when you're thinking you're going for something routine enough as bleach, I guess. And then you add in the extra layer of complication of, okay, what is going on? But I'll try with another one. So I was on call overnight when my team was paged for an admission from the emergency center. It was about 3 a.m. and I went to see a patient needing to be admitted for what I'll say, and I'll air quote it, allergic reaction, right? So male patient in his 30s, doesn't really have any past medical history whatsoever, presented to the emergency department complaining of severe shortness of breath, wheezing, and just anxiety. His symptoms developed while he was cleaning a saltwater fish tank containing zoanthid coral approximately 10 hours prior to the arrival to the ER.
So fun fact is, I used to have a saltwater tank.
Oh man. So this story really is going to get to you. Anybody who has a saltwater tank now is going to be like, wait, what happened?
Yeah.
Which yes, definitely. If you have one, listen for this whole story. So according to the patient, he agitated the coral during the process of something called fragging, which I assume is just like fragmenting. Or did you used to do this with your coral?
Yes.
Okay.
Yeah.
So you know what I'm talking about. Like
so
this
they can
fragging.
take pieces and then attach them to like rock, and then you can propagate it basically.
Wow,
so you can grow more of the same.
So the story is definitely for you, Cari, for sure.
It was too much work. I had to get rid of it.
So he was fragging his coral, and he says that this coral released a substance from its coral polyps. I guess not all coral have polyps. Maybe they do. Clearly, I am not a aquarium enthusiast here, but the coral released a substance from its polyps that bubbled to the surface of the tank that he could see. He said his face was about 2 feet away from the water's surface, and then within minutes, he developed what we call dyspnea, which is that difficulty to breathe, that shortness of breath. He said he felt like he had a fever. He was hot, but chills, nausea, started vomiting, had a sore throat. He attempted to shower, took an over-the-counter antihistamine, like a Benadryl, and wasn't getting better. And then he drove himself to the emergency center. He just kept getting progressively worse and worse. And was like, hey, I need to go in. This is bad. Can't breathe. So when he got to the ER, he was what we call hypoxic. So his oxygen saturation, the one you clip on your little finger and read it, and you want numbers like at least, above 90 there. He was in the mid 80s on room air, which we said he doesn't have any, he's not, didn't have a mask or oxygen on. Right. He's just sitting there breathing like a regular person, and he's in the 80s. So he's not getting enough oxygen. He's tachycardic, meaning his heart rate is elevated. When the ER doctor was listening to his lungs, he had decreased air movement throughout the lungs and just wheezing all throughout the lung fields. That's not a good combination.
No.
And definitely could be a sign of some kind of allergic reaction, potentially, is what the ER doctor thought. So he only reported allergies to things like penicillin, lidocaine, some grass. He would get hives when those things happened. And obviously none of which he had been exposed to recently. The ER physician started the patient on some oxygen. So he put a little mask on him and then put some nasal cannula through the nose, giving him that extra oxygen, gave him some IV diphenhydramine, which is Benadryl, IV methylprednisolone, which is a steroid, IV ondansetron, which is a nausea medicine, Zofran, IV labetalol, which is a medication to slow down the heart rate, and lots and lots of fluids. And then he gave him some albuterol inhaler for asthmatics who might know that is something just to kind of open up the lungs and help with wheezing. He just said, man, I'm going to shoot him with everything and I suspect some kind of allergic reaction. It was interesting. They didn't give him like an EpiPen or anything.
That's what I was just about to ask you. Yeah.
No.
Okay.
And I guess, he's extremely tachycardic and stuff. And so I'm wondering if they were worried about giving the epinephrine, if that would have made his heart rate again too high. And they were just kind of monitoring really closely to say, hey, all of a sudden, if he really stops breathing, you might have to do that. So not really sure why that one was left out if they thought it was an allergic reaction. But he started to get a little better by wearing the oxygen and having all those treatments. We talked about it. His oxygen saturation started to get a little better, just the low to mid 90s. You were still requiring oxygen though to get it there. And the ER physician consulted our team for admission. Based on the patient's continued workup and my differential diagnosis, yes, we're still thinking allergic reaction, thinking maybe some kind of reactive airway disease or some asthma-like reaction since he never had asthma before, some kind of infection, or even toxin exposure. So I'll cut to the chase and give you the good part.
Okay.
Final diagnosis: zoanthid coral palytoxin chemical pneumonitis.
Of course.
I think that's like my favorite thing to say.
Yeah. I would say a pally what? I've never heard of it.
See, right? Even as a doctor, you've never heard of it. Trust me, I hadn't either. The best part was trying to explain all this to one of my lead teams and being like, hey, this is what we're suspecting.
What's really funny is they always tell you don't go looking for zebras.
Oh yeah.
And you're like, this is absolutely a zebra.
It was absolutely a zebra. So this is just really rare. I presented this case report actually at a competition and won. That's how rare this case was. So back to our interesting part of the story. So chemical pneumonitis occurs when a patient inhales a substance that is toxic to the respiratory tract with the potential to result in respiratory distress, that shortness of breath, that uncomfortableness he was experiencing. Exposure to common items such as gasoline, that makes sense, really large amounts of gasoline, kerosene, paraffin oils, they have the ability to induce that chemical pneumonitis. But in this case, our patient had an exotic source of toxin-induced chemical pneumonitis from palytoxin. And palytoxin is actually found in that zoanthid coral we were talking about. So Cari, I don't know what kind of coral you had, but this is a big deal.
To be honest, I was a poor college student, so I probably had whatever was free.
You never know.
Yeah.
So palytoxin is a deadly marine toxin found in the polyps of many seemingly benign coral species available for purchase from local pet stores. So you never know. This could have been yours.
Could have been.
Zoanthid coral species are commonly referred to by their colloquial names, such as button polyps, sun polyps, yellow, orange, or green zoas, watermelon, scorpion, or people eaters, or sunset palets. Okay. And I can tell you this, after doing tons of research, the coral enthusiasts and aquarium people, when you ask them about palytoxin or talk to them about coral and this and that, they know all about it. They're like, oh yeah, we know that. But we as doctors are like, what in the world is this? So what is it and why? Again, palytoxin is extremely toxic. The way we measure how toxic something is by looking at something called the LD50. LD50 is the amount of a substance that is lethal to 50% of a group of test animals. So we just have to standardize it.
Yeah.
And so for context, the LD50 of palytoxin is very, very low, meaning a very small amount of it via inhalation can cause 50% of that group to die lethal, right? So by comparison, this low levels at a 0.36, and then ricin, which we also hear commonly as a toxin. We know ricin is pretty scary. Yeah. That's up at 500. So you need a whole lot more ricin, actually 1,400 times the amount of ricin as polytoxin to kill half the tested population.
Wow.
So this stuff is legit, and it's in your aquarium. There have been several reported cases of dermal exposure. So meaning like on the hand. So maybe Cari, while you were cleaning your aquarium, you might've cut your hand with it. And that's not as terrifying. And usually, that just doesn't have it nearly as low of the LD50. Inhalation to exposure to palytoxin, like in this patient we're talking about, is rare. And there's only a few case studies that have been published. Since I did this presentation and saw this patient, I got to see one national news article about it. Actually, Fox News did one about it, about a case in the UK. So I got really excited when I saw that.
Yeah.
And
should have volunteered as an expert witness.
I know, right? And there was an episode, spoiler alert for anybody who watches really old school, the crime shows like Criminal Minds, has an episode on it. And that's what killed someone in it. And it wasn't a murderer. So spoiler alert if you watch that one episode. So it's pretty cool. So really there's not a whole lot of cases. So there's not much to go on as far as like medical literature, but all the marine enthusiasts, like I said in other blogs, they talk about events related to this exposure, and they are all aware that after cleaning tanks or attempting to dispose of coral, this can happen.
Wow. I mean, I guess they shouldn't have called you. They should have called their coral expert friends, right?
Right.
That's very freaky and spooky. It's a highly lethal aquarium toxin, more toxic than ricin. That's bananas. So, I mean, I know you told us kind of how toxic it is, but how does it work to cause so much damage?
So palytoxin causes violent contraction of the skeletal, smooth, and cardiac muscles, resulting in disruptions of the cardiovascular system. So your heart, how it's pumping. It causes breakage of the red blood cells called hemolysis, and then a release of a bunch of inflammatory chemicals in the body like histamine, prostaglandin, norepinephrine. It's one of the most potent coronary vasoconstrictors known, which is the coronary arteries feed your heart and how your heart has blood supplied to itself. If that blood supply gets cut off with constriction, obviously it's going to cause damage to the heart pretty quickly. It can kill animals in minutes by cutting off oxygen to the muscles of the heart called the myocardium. This data explains the patient's hypertension, right? The high blood pressure, the bronchoconstriction, the difficulty breathing, and the tachycardia at that high heart rate. There is no antidote for palytoxin exposure, and treatment is supported with IV fluids, extra oxygen, and intubation if necessary. It's not uncommon for patients to have effects long-term, particularly weeks afterwards with difficulty breathing, mild wheezing after this exposure. So why do we care? So yeah, really.
Why do we care?
Marine enthusiasts definitely need to be advised to take precaution when cleaning. So next time Cari decides to, on a whim, to go buy some new pet coral, just be careful when you're cleaning or disposing any species of coral in the United States, because there's no restrictions and nobody warns you when you go to the pet store when you buy them. Due to its lethality, physicians must be able to actually include this toxin exposure in a differential diagnosis. I mean, when this patient kept talking about this coral was the reason. I was like, he's crazy. Like I did run a drug test on him too. Don't worry. That came back negative, but I'm just like, why would that be the case?
You're like, so, he's on something. He's hallucinating.
I'm like, it's not your pet coral. I'm sorry.
But it was.
It was.
Yeah. So in this instance, what happened to your patient?
Yeah. So he was admitted for continued supportive treatment. 7 hours later, he was improving, had some wheezing. We kept monitoring for another 24 hours, just kept giving him all that supportive care stuff. What got him back to about a pretty good baseline, just at least got him so he didn't have to be on oxygen anymore, and we're able to discharge him home. It took him several weeks and even needed to use an albuterol inhaler to keep his from wheezing until he could finally get back to normal activities. We stayed in touch afterwards just so I could make sure that he got better.
Exactly. Interesting. Well, I thought I almost included the case about a patient that I had that had anaphylaxis from a swarm of, I don't think we call them killer bees anymore. I don't know what their correct term is for them, but killer bees, basically, that attacked him all at once. And I thought that was scary. I didn't know that cleaning your pet coral could be as deadly. Well, I'm pretty sure we could go on and on about fascinating patient stories, but that's it for today's episode. We hope you guys can all sleep well tonight after all that information.
Don't forget, if you're a listener claiming CME credit, please look in the show notes for some instructions on claiming that credit.
And for all of our listeners, thank you for tuning in. Please like, subscribe, and share this episode. Let us know what other topics you're interested in through our Instagram, and please stay tuned for the next episode.
And happy Halloween.